So this advanced surgery, this single port surgery, that's something that you developed at Cleveland Clinic. Has that technology been introduced in other centers? Would someone only find that in an academic center, or might they find it in their community hospital? And where do the surgeons get trained for that? Is that something that, say a resident or a fellow these days would automatically be learning because it's the standard of care? Or please speak to our viewers about that. Yeah.
So single port surgery, we developed it along with a few other doctors in a couple of different countries actually, but we seem to take it up and really do a large volume of surgeries with the technology with these techniques. But since then, many centers in America and then many centers internationally certainly have taken up these different techniques just because of the interest that patients, I think, have in having smaller and less incisions. So it's really an exciting area of growth and development. The problem has been that the instruments that we've had aren't really specifically designed to all go through one small incision, and so there are some challenges. Even though we can do the surgeries well, it's not easy for a less experienced surgeon to be able to do something like this. So I think where we've finally gotten more recently, and in the very close future, we're going to have technology, robotic technology that's specifically designed for these type of procedures, and there's a good chance that this is going to make this possible, available for all urologic surgeons, and even for less experienced surgeons to be able to do this very well.
That's very exciting. So a question that comes up in my mind about this is, when you say robotic surgery, does that mean a doctor could be in Cleveland doing a surgery on a patient in Cincinnati or in Idaho, or is it mainly just that the doctor is at the same place as the patient and using this technology to improve precision? I guess the question said otherwise was, does this allow a doctor of really high training and skill to operate where he isn't, and thus spread the reach of the new technologies?
Sure. So currently, doctors usually are in the same location as the robot and the patient, but this technology was originally designed even for battlefield medicine, so that surgeons can be in America, but the robotic instruments, the patient, are set up in Iraq or another war zone, and so we can do surgery that is remote, we call it, where it's far away. So I think with the development of better cables, communication cables, the internet, improvements with the internet, and decreases in costs with that, I think over time it will be more possible to have the surgeon in Cleveland and the patient in another location, so that perhaps even more experienced surgeons can do surgeries without the patient having to travel.
Amazing, amazing.